topic is basically the basics of Medicare, Part A. Here's the thing about Part A and Part B both, as we get rolling on here, is that the more that you understand how Part A and Part B works, the easier it is for you to explain it to your customers. And as you explain it to the customers, you're going to see that they are going to want to get some sort of a plan, whether it's a supplement plan or an advantage plan, to help cover all the liability and cost that having just A and B present. I mean, it is just hugely expensive and has the potential to just put somebody into the poorhouse, as you'll see here. Now, as we get started, we're going to try to answer these questions. We're going to break this down. What is Part A and what is Part B? The more you know and can explain just how Medicare works and what's covered and what liability each member has, the easier that sale later becomes. We've seen this before. These are the 4 parts of Medicare. A is inpatient hospital, B, physician and medical costs, C, think of that you're going to be your Advantage plan, and D is prescription help. But today, what we're going to concentrate on is just that Part A. Now, and the general statement is that Part A covers inpatient hospital costs, but we're going to see that it is just so much more. There are many situations that you can be in that you're not an inpatient in the hospital. And I just have to really stress the aspect that Part A pays for the inpatient hospital care and the inpatient care in a skilled nursing facility. Now, home health care is what it is, and hospice care is what it is. So those two aren't anything that's in particular. I have to just step back here for just a second. It just dawned on me that I'm rattling away, and I don't even know if anybody can hear me. I always do like to ask that question. If somebody could just give me a quick chat and tell me if anything is coming across. It would be either you, Laura, or the one that's calling in on the phone probably can't do it. Let's see, maybe Laura can. You give me a quick chat and let me know if there's any volume there. Can you hear me? Oh, perfect. Thank you very much there. So I'll just continue on. And what we were saying is that Part A, and like I was saying, that I was stressing that inpatient. If you're being held for observation, which is one of the classic things that happens to people when they go to the, where they're at the hospital, but they're not an inpatient. You're, like I said, you're not an inpatient, so observation is not going to be covered under Part A. Emergency room visit is not covered under Part A. Maybe you're there for same-day surgery, right, where you're just doing it as an outpatient. Again, outpatient. You're not an inpatient. So those kinds of things are not covered by your hospital Part A. So hospital Part A. So now when we were looking at that, you saw that the Part A covered more than just being in the hospital, right? It also covered, skilled nursing facility, home care, hospice. So we're specifically talking about that component that was the part where you've been admitted to the hospital. Yeah. So your doctor can recommend things, right? That could be part of the treatment that you're getting there. And if your doctor or your healthcare provider, recommends that you get services, more often than Medicare covers, or they may recommend that services that Medicare doesn't cover. If this happens, you may have to actually pay some or all of those costs. So you want to encourage people to ask um, when their doctor is recommending these things, whether or not Medicare is going to be paying for them. Because exactly what they cover as part of that hospital is a semi-private room, the meals that you get while you're in the hospital, any of the nursing care that you get, drugs, because we normally think Part D for drugs, or maybe even Part B for some of the drugs, but you'll see that while in the hospital, any drugs that are part of your treatment are going to be covered by Part A, and any other services or supplies that the hospital brings to the table. Those will be covered. So I think here, let's see, that's what I was trying to get through. There we go. Okay, so hospital care can be an acute hospital. So this is like where you can get it. This is your inpatient, can be at an acute hospital, critical care. You can be in a rehabilitation facility. There are long-term care hospitals. Remember that Medicare itself doesn't cover long-term care, but it could cover that your inpatient stay in a long-term care hospital, but not for the long term. Okay, so that makes sense. Inpatient as part of a qualifying clinical research study, or you could be in a mental hospital. As you're going to see, there's going to be some other limitations on mental health. Now, if it was billed separately for a television or a telephone being in your room, Medicare would not cover that. If you had a private nurse, Medicare wouldn't cover that. And if you are put into a private room, unless it's medically necessary, maybe you have a contagious disease or something like that, Medicare wouldn't cover that unless there was some medical need that said that you had to have a private room. So now we're going to look at the skilled nursing facility. Okay. So if it's a skilled nursing facility, I always ask that question, what is a skilled nursing facility? Well, the short answer is that it's not a nursing home. Okay. Now, Medicare doesn't cover nursing home. However, a skilled nursing facility could be housed in a nursing home. Okay. It could be in a regular hospital. It could be freestanding. The significant attribute of this type of care is the type of care that's being provided. Okay? A skilled nursing facility is going to provide medically necessary nursing and rehabilitation services. Now, to receive Medicare coverage for a skilled nursing facility, a physician has to certify that you require the daily skilled care that can only be provided as an inpatient in a skilled nursing facility. And that's why it's in red here. You must have been an inpatient in a hospital for at least 3 consecutive days for the same illness in order to meet that condition for being admitted to a skilled nursing facility. So you can't go to the emergency room and go from there to a skilled nursing facility. Okay? So you have to have been an inpatient for at least 3 days. I had a daughter that's a nurse that worked at one of these skilled nursing facilities, and that was one of the biggest reasons people were turned away, is they went in thinking that Medicare was going to cover it, and they did not meet that 3 consecutive day rule. Now, sometimes people get, discharged from the hospital and they go home thinking that they can handle everything, and that it's, not they don't feel they need the skilled nursing facility, so they've chosen to go home. Well, provided that it is not for greater than 30 days from your discharge, you can go to a skilled nursing facility. Okay? And of course, that facility has to be accepted by Medicare. And again, you're going to get that same thing. You get the semi-private room, meals, rehabilitation, services that are going on, and prescription drugs while you're in the facility. So what happens when you don't meet that 3 consecutive day rule? Is that it? You're all done? Well, it's not quite. Oh, I got a little ahead of myself. Cost while you're in the skilled nursing facility. Okay. Medicare covers that first 20 days, so I call it the first 3 weeks, completely. You have zero copay. You just, the typical scenario would be got sick, wound up in the hospital, had there 3 days, needed some nursing care to get rehabilitated back, so they spent another week or 2 in the skilled nursing facility and went home. That's the pretty standard. That happens a lot. But the way the fees break down, though, is Medicare fully covers the first 20 days. If you still need to stay beyond the 20 days, it's $176 per day from days 21 to 100. That's all within that benefit period. Okay? After 100 days, the individual will take all the cost. So can get quite expensive. Okay. So this is where I was saying. So now, what happens when you didn't qualify for that and you weren't able? Oh, just as a little note here, I forgot about this slide. I added this one. During the COVID-19, that 3-day has been waived for COVID-19 patients. They could essentially come into the emergency room and be sent to a skilled nursing facility. Okay? Not enough rooms in the hospital, the ICU, and you have COVID-19. They know that you're going to need the care. They just skipped over that hospital stay part. So that's been waived for COVID-19. But most people, outside of a specific pandemic that's going on right now, if you couldn't get your 3 days of hospital inpatient, you're going to probably want to look at the home health care. Right? So for home health care, it's going to be pretty much the same kind of services, only now it's part-time or intermittent skilled nursing. Okay? You still, maybe they just need to come in an hour or so every day, do some vitals, change some bandages, and you're done. Okay, something like that. So you just need some part-time intermittent skilled nursing care. Maybe you just need physical therapy, and the physical therapist will come to your home and do the therapy. And it goes on for speech and language, that kind of thing, for maybe a stroke person who had a stroke. Any kind of continued occupational services. Here's the thing, is that your beneficiary's physician is going to certify that the care is medically necessary and you have an approved treatment plan. So they have a plan that they put together, and it's usually has a start and a finish, so it doesn't go forever. There is a plan on exactly how long you're going to get this skilled nursing facility type care at home, right? A couple of things that you do need to be aware of is that it is not 24-hour nurse care. They will not do that. They're not going to cover meals being delivered to your home. There are other programs that could cover that, but we're talking about what Medicare covers. Maybe Meals on Wheels could come by, but that Medicare itself is not covering meals being delivered. They're not doing what they call homemaker services, which is, cleaning, laundry, that kind of stuff. It's not covered by Medicare, or any sort of personal care, which could be like bathing and that sort of thing. So just some good examples is that you have to have Part A at least, and or some Part B, and you have to meet those conditions. And it's been put together by your doctor, and so your doctor is going to certify that you need maybe like if all you needed was drawing blood, that you're expected to simply go to the lab and have done. But intermittent nursing care, physical therapy services are covered only when the services are specific, safe, and an effective treatment. The amount, the frequency, the time period of the services needs to be reasonable, and they need to be complex, where only like a qualified therapist can do them safely and effectively. And to be eligible, either your conditions must be expected to improve in a reasonable and generally predictable amount of time, right? So I mean, you can't have that go forever. Got it? I think that kind of drives home that picture. This is meant to be something that is temporary. Okay. Then there's hospice care. Hospice always also falls under Part A. Now, hospice is going to cost zero to it's 100% covered by Medicare. There is some copay for drugs that are administered, but it's quite inexpensive as far as that goes. So the key thing is that is the terminally ill. Now the services could be, in your own home, and it would then include some kind of home health aid, and it can include at this point, medical social services, counseling, some homemaker services. These can be included in the hospice. Okay? And again, that's at zero cost. So there's a co-payment of no more than $5 for each prescription drug. But here's the thing. When you go into hospice, whatever your problem was, maybe it was a cancer or some other type of disease, all the efforts to cure the disease stop. Okay? So they're not going to do that. The whole point now is they're going to allow you to, usually they call that, to die with dignity, so that they're going to be some pain control, that sort of thing, keeping the person comfortable. And but they're not going to kind of try to continue to cure the person. I have a friend who has got some cancer that comes and goes constantly. Little tumors appear, they remove them, and all that has been ongoing for 10 years. At one point, they were recommending hospice for her, and that was over 10 years ago. And she declined that, knowing that all the effort to keep you alive stops. All they're going to do now is just try to keep you comfortable. She figured it was better to be alive and uncomfortable than to be comfortable and dead. So that for her was not an option. She did not want to take that. And while she does have a pretty restricted life, she is not in pain or anything like that, and does consider, that she did not want hospice. so for her, it didn't work, or what didn't work. And the other thing is that people sometimes were expected to be terminally ill, but did get well, even on their own, even though the treatment had stopped, they got well and have been discharged from hospice. Okay, so enrolling in Medicare. Here's kind of the thing about that. Okay, if a person is 65 and they're already receiving Social Security or their railroad retirement benefits, remember those can start at 62. And a lot of people, wait till 66 because that's when they're at their maximum. Okay, so they'll wait till 66. But many people are already on Social Security when they turn 65. And for them, that's an automatic enrollment immediately into Part A and Part B of Medicare. They'll get that package. Will simply come in the mail to them about 3 months prior. So let's say that your birthday is April 15th. Sometime there at the end of January, that package simply shows up in the mail. You can decline your B. Maybe you're still working and you have group coverage at work. You can decline Part B. We'll talk more about that later, about repercussions and what one needs to do. But as soon as you turn 65, you want to get Part A. Now, if you're on a Social Security disability, you could be well under 65, and after you've been on disability for 2 years, what's going to happen is about 3 months before that 25th month of receiving disability benefits, you're going to find that you're now on Medicare. Okay, so you'll just get that A and B in the mail. Now, if you turn 65 and you're still working, or they're not necessarily, but you're not drawing Social Security yet, you can simply go about 3 ways of getting your Medicare. I usually recommend to most people that they just go online and do it online, taking about 10 minutes online, go through a little verification process, and you'd be signed up. You can do it over the telephone by simply calling Social Security. Here's the hitch, though. Call Social Security, just be prepared to spend an hour on hold. Okay, so it was much easier to go online and do it. And you can always visit your local Social Security office. Now be prepared to spend a morning or an afternoon down there. Okay, so those are the options. I usually would say online is number 1, over the phone is number 2. Now, if you are a person that the easiest example I could give is that you immigrated to the US, maybe, and became a citizen and all that sort of thing. That's going to be difficult to do online when they ask you to produce documents, okay? So that's the kind of thing that you need to go to the office for, so that you can show your naturalization papers and things like that. It's just, those are where you would be going to the office. For most people, online or over the phone is the best way to go, okay? Now, everything I gave you also applies for railroad retirement, except it's a different phone number. Now, for those who are railroad workers and are now retiring, they have to call the Railroad Retirement Board to get signed up for their Medicare, whereas everybody else fell under Social Security and they go to Social Security to sign up for their Medicare. Yep. Social Security doesn't do much else other than do the signups for Medicare. They don't do the billing or any of that stuff. They just do that initial sign up for Medicare. That's handled at Social Security, or again, the Railroad Retirement Board for those who are railroad employees. So let's talk about the enrollment period, okay? Now, like I said, we're really now kind of talking about the person who's going to do it themselves. They were not on there, so it wasn't automatic. They have a 7-month window. Now, in that 7-month window, you can sign up for your Part A and Part B. So let's go back to that example where your birth date was the 15th of April. You could literally on the 1st of January, not that they're open on the 1st, but on the 1st of January, you could go down to Social Security or call them on the phone or go online and do your sign up for Part A and or Part B. The only little caveat in there is if your birthday was actually the 1st of April, your Medicare is going to start on the 1st of February. For those whose birthday is the 1st, their first day in Medicare is the first day of the preceding month. For the rest of us, we're going to be the first day of the month of our 65th birthday. So now you can do that right up until 3 months after the month of your birthday. So here it was April. So I've also got May, June, and July. I can go to the end of July to sign up. Okay. Now, if you miss that window for whatever reason, now you have to go during the general enrollment period. And the general enrollment period begins 1 January and ends on 31 March of each year. So if you didn't sign up for Medicare, when right back when you were 65, when the big window was open, now you got the 3-month window each year after that to sign up. Now, there is an SEP for this. So if you are eligible under the SEP, you can do that. Okay. There's only one SEP, and that SEP is based on your current employment. If you lose your group or employer health coverage, you're able to enroll at that time. Now you have an 8-month window from the time that your group coverage ends in order to sign up. And again, Railway Retirement Board, you got your own number for that. But so for those who continued, working past 65, I usually would have recommended that you got that Part A back then. But if you didn't, that's okay. It's just that your Part A, with whatever group insurance that you have, it would work. Maybe you got one of those group plans, but your insurance deductible is $5,000 or something like that. Remember that Part A's deductible was $1,408, so I could really lower my deductible if I was admitted to the hospital by having Part A along with my employer. So anyway, so those who didn't sign up when they turned 65, that loss of their group health plan is the only, and I have to just repeat that, is the only SEP for enrolling in Medicare. We're going to see in other lessons that for things like Advantage plans and all of that, they've got other special enrollments. And sometimes I just don't want you to get confused enrolling in Medicare with enrolling in a Medicare supplement or a Medicare Advantage plan. So we're talking specifically Medicare, one SEP, loss of group health. So the premium, most people are going to get Part A at zero cost. Okay? It's not that it's it's free. I don't ever want to think that, because you paid for it. Okay. When we're working, you look at that pay stub and you see all that money going off to Social Security, taxes, and Medicare. So You're literally paid for your Part A during that lifetime of work. There is a minimum. You do have to have 40 credits, which equates to 1 credit per quarter. So that equates to 10 years worth of work. I know that when you listen to a lot of the political talk, you hear that, oh, people are coming here and they're getting free health care. Well, remember, you can't buy anything if you're over 65. It's only Medicare. And if you have to buy your Medicare, it's $458 a month for just Part A. Okay? Now, if you did work, but you didn't do the full 40 quarters, if you got up at least 30, you can lower that cost down to $252. Okay? I've talked to many a person who immigrated to the U.S. who had to delay their enrollment and continue working so that they would qualify for the zero premium Medicare, okay? Or the Part A at zero premium. So there is a cost to it. You're going to find that the actual value of Medicare is it's around $900 a month if you add up all the costs if you had to pay for them. The deductible. So Part A does have a deductible, and here's kind of the way that works. Remember, it only applied for inpatient stays, where it's going to really come into play anyway. Is a $1,408 deductible, and that was good for 60 days in the hospital. At day 61, it goes to $352 per day copay, along, so you've paid the deductible, and now you're going to pay $352 copay per day for days 60 through 61 through 90, so another month in the hospital. Now, we do have, and that is within your benefit period. Remember, a benefit period is about 90 days, the way that they put it together. And I always try to stress that under your worst case, if you were hospitalized in each benefit period during the year, you could pay that deductible 4 times. So that's one of the liabilities that comes along with Medicare. So keep that in mind as you're explaining this to your customer. This is what we're looking to cover with that Medicare supplement plan or that Medicare Advantage plan. Now, each person does get an additional what they call lifetime reserve days. So you got the 90 days per quarter automatically, but if you stayed in the hospital for some extended stay beyond 90 days, you have I shouldn't say one, you have a 60 days of reserve, and they can be used individually or all at once, however you use them up, right? But you're going to pay $704 per day when you're using that. If it goes beyond the reserve days, you pay the full cost of the hospitalization per, days beyond that, what's that, 90 and 60, 150, beyond 150 days. If you look at supplements, okay, I always like to remind people, if you look back at your Medicare supplement and those plans F, G, N, they paid for 360 days in the hospital. So you could actually be in the hospital for the whole year on a Medicare supplement and have it all covered. Now, if that hospital is and you're hospitalized for psychiatric, you are limited to 190 days in a lifetime for psychiatric hospital. That's all that Medicare will pay for. So that's kind of the way Part A works, okay? So now we're going to dive into Part B a little bit. Take a look at Part B. And for parts of Medicare, kind of zeroing in here on Part B. Yep. Again, they always say that it's going to cover you for your physician and medical costs. Well, that's so general, and I could break that down even further. It's going to be for services or supplies that are needed to diagnose or treat your medical condition that meet the accepted standards of medical practice. It's also going to include preventative services, and that's your healthcare to prevent illness. Uh, Things like flu shots, okay? Or to detect, a disease in an early stage. Think of, the cancer screenings, when they can do a treatment that would be most likely to work. If you have Part A and Part B together, you are going to see that referred to a lot as original Medicare. So when you hear that term original Medicare, think A and B both together, because there's a lot of things that will say and or, but original Medicare is looking at the two of them together. So the first part of looking at Part B, because we're going to look at it a couple of different ways. Think of it as your doctors and outpatient kind of services. As kind of a rhetorical question, how hard do you think it is to find a doctor that takes Medicare? Okay, if you think about that for a moment, what you're going to find is a lot of times you hear there's a resistance and all of that, but when it really comes down to it, they did a survey of the doctors and found out that when it comes to primary care physicians, about 98% of the doctors that are primary, non-pediatric, okay, not a children's doctor, that took Medicare. So those are all the, that first doctor that you would see for most things. Specialists, it's a little bit different of a story. You may have to find one that will take Medicare. But as far as primary care doctors, it's not going to be too much of a problem. So this is going to help. This is what Part B does. It helps pay for the doctor visits, outpatient services. So let's think about that surgery that you need, that they're just going to go in and you're going to go in the morning, go into surgery, do whatever they're going to do, and then you're going to be discharged and on your way home by the end of the day. So you're not even staying overnight. Okay? Outpatient. Durable medical equipment. The ones that always come to mind to me are going to be things like diabetes meters and stuff like that, CPAP machines, wheelchairs, that kind of equipment. Any kind of diagnostic stuff, and I say X-rays, it could easily have been MRI, that kind of things. Lab tests, these are all going to be your under your Part B. So let's kind of break down that, when we say doctor services, got to be medically necessary. Okay? Outpatient, these got to be approved procedures. Okay, we're not just Medicare approved. It could be, you could be having some kind of cosmetic surgery that's outpatient. That is not going to be a Medicare approved surgery. Clinical services, blood tests, urinalysis, those are, your lab work. And I broke down that durable medical, but I always like you to think, just beyond a little bit because that's that durable medical equipment, prosthesis, supplies, diabetic testing, because that's, the test strips, the meters, all of those. One of the big ones that comes up all the time is you've seen that Freestyle Libre where you put on the little device and scan it with your telephone and your cell phone, and it'll tell you what your blood sugar is, and that, hey, well, that's going to be covered by Medicare. It's just that, one, it has to be prescribed by the doctor, and number two is you're probably going to wind up paying 20% of the cost of that machine. Okay, those things are not going to be covered the way people think covered works. And if you get off into some kind of an HMO or maybe even a PPO plan, they may only have a list of medical equipment that they cover. That would be the meter and test strips. They're not going to cover the Freestyle Libre. That one comes up a lot. You get a lot of questions on whether they can get that or not. And preventive exams in your well checks. The other way to kind of break down Part B is to look at it as medically necessary services and preventative services. Okay? So services are supplies that are needed to diagnose or treat your medical condition that have to meet the accepted standards of medical practice, or it could be to prevent an illness or detect it at an early stage. Okay? So we'll look at, it's just another way of dividing up your Part B. So when we say, doctor visits, clinical research, ambulance, they're going to be covered by Medicare, but I don't want you thinking that means zero payment. So you can get a lot of this stuff, but it'll have a copay attached to it. And remember, in Part D, it's not a copay, it's co-insurance, and you're paying 20%. And one of the things I always point out is it says limited outpatient prescription drugs. Usually think of those as drugs that you don't give to yourself, like those that you would get in a doctor's office or a hospital outpatient setting. Chemotherapy, that's where you would go in. Maybe some kind of an infusion where it's a massive dose of steroids or a massive dose of vitamin of something. They've got these infusions that they do. It's not something that one can give themselves, and it requires a hospital or outpatient setting. Maybe you've had a friend that's had to go in and get a hydrocortisone shot in their knee because they have, some arthritis in there and they're bone on bone, and it just, get one every 6 months and it helps control the pain. So those are the kinds of drugs that are covered under Part B. The other one that I would use to think about Part D is think of a drug that the doctor does not write you a prescription and you go to the pharmacy for. That's going to be Part D. Okay? Part B are the types of drugs that you would not be filling a prescription for yourself. Oop, wrong way. Okay. So now, okay. Preventative and screening services. These on this list, these are what are done at zero cost. In other words, your doctor, they all have a frequency attached to them, and you can go in and there's not a copay when you go and have this stuff done. Okay, just like with many of the standard health plans, an ACA type plan, I always like to really draw the difference between a screening and a diagnosis. One of the ones that comes up a lot and is questioned a lot are going to be colorectal cancer screenings, right? Because we all know that a colonoscopy is pretty expensive. They started back when you were in your 50s, so hopefully you got one when they were first eligible, so your next one should be coming up at 65 or so. So now you're on Medicare. As long as that is a screening, meaning that when they go in and they do it, they didn't find anything. Because here's the common one is that Okay, they go in, they get their screening, the doctor finds a couple of polyps, they remove them at that time. Okay, they will just go ahead and remove those polyps that look like they could be cancerous and send them off for a biopsy and that sort of thing. But now the doctor says, I want you to come back in 2 months or 2 years to do a check on that. That ain't a screening anymore. Now that's diagnostic. So it's no longer that zero cost. It's now going to fall under that 20% cost. So you see that those that are in there. I think the one that I know is an exception to that is mammograms, because you could have had breast cancer. They did the surgery, removed not a full mastectomy, but they just removed the cancerous area. You still are going to go back and get an annual screening. Okay, that is going to be done on an annual basis. That doesn't become diagnostic like the colonoscopy does. And let's see here. So the shots, we always think of the flu shots, hepatitis, pneumococcal. Those are all going to be at zero cost when you go in and do it. Okay? Now, other shots are going to be covered by Medicare and but they're going to fall under Part D, as in your drug coverage. Things like a shot for tetanus or a shot for what's that other one? If you've had chicken pox, you can wind up with not rickets, but that I forget the name of the disease. But anyway, those are covered by Medicare, but they're covered under your Part D plan, and you would have a copay that goes with those. This is the list of zero cost stuff. So for most people, Part B is going to be that $144.60 but it is going to be based on income. So it could be as much as $491.60. For some people, if you make enough income, you're still partially subsidized. I think the 191, the government is still paying 15% of the cost of Part B. But for most people, the government pays all but the $144.60. And for the people that get it, they normally will have that deducted from their Social Security check. Okay? Nobody wants to write a separate check for it, but that is an option. Okay. So the annual deductible for Part B is $198. It changes from year to year. Okay. And then, so here's the kind of the way it works. This is after your annual deductible is met, the medical insurance will generally pay 80%, and you'll wind up paying the 20%. Here's the thing that I like to drive home, especially when I'm selling Medicare plans to people, is that on Part B, there is no maximum out of pocket. You're not, once you reach $5,000 or, even $10,000 done paying. You will pay 20% whatever that amount is. The way I always drove it home was I would say, literally, if you could find a doctor that would see you for $100, your payment would be $20. They would collect that at the time of service. When you went in to see the doctor, if all you had was Part A, they would ask you for your $20 payment at that time of service. Likewise, if you had a surgery and that surgery was $100,000, your share is $20,000. And unless you can get in and make some arrangements, that $20,000 is expected at time of service. That is why you want either a Medicare supplement or a Medicare Advantage plan, unless you keep that kind of money laying around in order to pay the cost of your co-pays for Medicare. Okay. So that's oh, and we haven't even got into the fact that all of Medicare billing is by code, and doctors can actually charge 15% over. So going back to that example of the doctor, that was $100. Let's just say that $100 is what Medicare says is the reasonable fee for a doctor visit. So I don't know this to be the numbers, but I'm just kind of drive home the example. So $100 is the acceptable cost of a PCP visit. Your PCP says, I'm better than most of those doctors out there. I speak multiple languages. I'm an internist. I also teach. I'm just better than the average out there. So I'm going to charge the 15% extra that Medicare allows. So my fee is not the $100, it's $115. So Medicare says that they'll pay 80% of the fee, so of the accepted fee, which was the 100. So that left me with 20. Plus, I have to pay the 15% myself. So instead of $20, it's 35. Okay. So that's just one of those things that goes on in there. So there could be an adjustment. So when it comes to those premiums, I told you that it was based on income. Here's kind of the table for 2020. I don't want you to really get too hung up on what those additional cost is for the Medicare, even though they do get pretty big. The big thing that I'd like to call your attention to is that for 2020, the income tax year that was being based on was 2018. So what this means is that for many of our customers, because I've had a few that took maybe a couple years ago, sold property, and they got their exemption, but they still had some that they had to pay taxes on. So their tax return showed this extra money. They took a severance when they left work. So that they wound up with some huge paycheck for that year. And that year was, 2 years ago that they got that money. So now Medicare is, CMS is looking at what to charge, and they go, oh, well, you made, 250,000 joint income back in 2018. So instead of 144, yours is going to be 289 for Part B, for you and your spouse as Part B. So but then they come to you saying, hey, I don't make that kind of money now. Well, it'll adjust out, as it goes forward, but they're being hit right up front because of that 2-year look back. So just be aware that it's out there, that they're looking at not what you're making right now, but what you made 2 years ago. So if you don't sign up for Part B when you're first eligible, now remember that if you stayed in a group plan at work, there's not going to be a penalty because you're going to be able to sign up with a special enrollment period. But for those who, they didn't sign up during that 7-month window, and they blew off the open enrollment, and now they want to sign up, they have to wait again for the open enrollment. And it's for every 12-month period from your eligibility, it goes up 10%. For that person who blew it off for a year, that 144 now becomes an additional $14.40 for the rest of their time in Part B. As long as they have Part B, for that 1 year will cost them an additional $14.40 per month for life. Okay? If it's less than 11 months, there's no penalty, so you don't have a problem with that. You can have that automatically deducted from your Social Security or from your Railroad Retirement Board pension check or even your federal government pension check. If you want to pay it yourself, you've got two choices. Quarterly billing statements where they'll mail you the bill and you write a check, or you can sign up for an easy pay where they'll simply deduct it from your bank account. Okay. Let's see, this is kind of a repeat of stuff that we've looked at already. I don't know what that slide's even doing there. But these are things that you know that you get under Part B. Okay, things that you don't get, and this comes up a lot. Okay, you don't get under straight Medicare all by itself. No dental, no glasses. Okay, no dentures, nothing on the cosmetic surgery. I think I've seen some exceptions made in the area of obesity, where they can, you know, do some of those stomach surgeries for weight loss. But again, it's going to have to, goes back to being medically necessary and that sort of thing. But in general, cosmetic surgery is not covered. I can give you some exceptions because this is a government program and you know how that all works, right? It says no cosmetic surgery. One that I have seen is in the cases of breast cancer for women. In some states have a requirement that they maintain symmetry, right? In other words, you can't remove half the tissue from one breast and then not adjust the person's other adjust her other breast so that they're the same size and look the same, so the appearance is the same. You got to maintain that symmetry. So some people would call that, you know, cosmetic surgery or a breast reduction maybe, but that's just a kind of, like I said, it's a government program. There's going to be exceptions everywhere you go. Acupuncture. You know, Medicare itself doesn't cover acupuncture, but I've seen Advantage plans that do. So, these are the general exclusions under Part B. Hearing aids and exams for fitting them. Okay, that's not, you know, hearing aids not covered. If you know what a cochlear implant is, that is covered. Okay, so that's not considered to be a hearing aid. Long-term care is not covered. Concierge care. Here's the thing about concierge care. If you want your doctor and your doctor is the concierge doctor, you can pay the concierge fee yourself, and then the doctor can bill Medicare for any of the other services that they perform. So, like I said, these are kind of the rules when it comes to that. So we talked about enrolling. There's Part B doesn't have anything different about it than Part A did. You know, you're still the 3 months, you know, the 6-month window when you turn 65. Still automatic if you're on Social Security or drawing SSDI. The same places to call to sign up. If you're, whether you're Railroad Retirement Board or want Medicare. So none of that changes. Okay, the general enrollment period. Here's the thing about the general enrollment period, and it can get people in trouble. It can even cause them to have to pay a penalty. We'll go back to that April birth date and you'll see what I mean. If you didn't enroll in Medicare Part B during your initial enrollment period, you didn't have that SCP, okay? And so you had to wait until January to sign up. So you that whole year went by, the rest of the year went by because your birthday was in April. You signed up in January. So you think that you're good. Well, you're not, because your coverage doesn't begin until July. And you now have that full 12-month gap. It's more than 12 months, but they do it 12 months at a time. So you would wind up paying 10%. Okay, so that's that key thing. If you use the general enrollment period, your coverage begins on July 1. Okay? So that late enrollment could apply. Okay, I just like to drive home on that the special enrollment. There is only one, and that is loss of health care. So don't, like I said, as we talk about other things in the upcoming weeks, and we talk about the SEPs that they have, uh, you'll see that I'll be reminding you then that the only one for Medicare is loss of your group health. Let me give you a classic example of what I'm talking about. Somebody left the country, they retired, they thought they would go live abroad for a while. They let their 65 come and go. They were living in Italy or in the north of Spain, having a great time, decided that they would return to the US and that they never signed up for their Medicare. They now have to wait for open enrollment. But what's going to happen is they're going to look at their Advantage plan that says returning to the US, I have a 60-day SEP to sign up for that United Healthcare plan. But that United Healthcare plan required that you have Medicare. You don't have Medicare. That SEP was for United's plan, not for Medicare. You're back to open enrollment, not starting till July, and then you can sign up for that United Healthcare plan because you started your Medicare. So, like I said, I'm going to get that question because I get it probably once or twice a year from somebody who says, I thought returning to the US was an SEP. Well, it's an SEP for the Advantage plan. It is not an SEP for enrolling in Medicare. So just keep that one in mind. Be careful with both of these, A and B. Don't speak in absolutes and don't overpromise. One of the most dreaded questions that I ever got and continue to get from customers is the one that starts off with, does Medicare cover, and then they fill in the blank. Okay? Because what I don't know when they ask that question is do they mean that it covers it? Do they mean that there's no copay? Do they mean that it's zero? What do you mean when you say, is it covered? Okay? So I always ask them back. I said, do you mean at no cost? No copayment? And the real bottom line usually works out to be that if it's medically necessary, it's probably covered, but it may require a prior authorization. So that's kind of my pat answer to is it covered is if it's medically necessary, it's probably covered, but it may require a pre-auth. So that's kind of what I've got for you here today. This again is just A and B. And if you want to email me at training@ahcpsales.com.